I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and today we're going to talk about gout. A lot of patients come in and they have pain in the big toe, and a lot of times, this can be arthritis, or this could be gout, or it could be gouty arthritis. It's hard to find out sometimes. But gout is when you have too much uric acid in the blood, and uric acid is one of the pieces of trash we produce through metabolism, and you either get rid of it really well or you don't get rid of it really well, and it goes through your kidneys, and sometimes you produce too much of it and sometimes you don't get rid of enough of it, and that causes the uric acid to rise. And uric acid is a crystal in solution, and if you remember in high school chemistry, if you put a bunch of sugar or salt in water and you heat it up, it tends to go into solution much easier. But uric acid does go into solution pretty well in your blood, but sometimes if you have too much, it becomes a crystal. It becomes out of solution. And oftentimes in your big toe joint, your big toe on your foot, you have a lot of pain and swelling, and it turns red and hot. And what happens is this uric acid becomes a crystal inside your joint. And so you have cartilage and cartilage, moving back and forth, and you have little crystals in there. And that causes a lot of pain and a lot of inflammation. And so the first sign of something like this is usually pain in the big toe joint. And it's not usually both, it's usually one or the other. And so to treat gout, this high level of uric acid, there's a blood test you could do to determine if it is high or not. But oftentimes we find that soaking your foot in warm water, again warm because that will put the crystal back into solution and get it out of your joint, that can help. And there are also 2 or 3 medications out there that we prescribe for this, and they usually help a lot too. Now sometimes when you have chronic gout, where you have this problem all the time, you have to take these medications for life. Other times when you have this problem only occasionally, then you can take these medications only when you have a gout problem or a gout attack. And in those times, you take these medications twice a day and the pain goes away in a few days. So gout is something that's related to uric acid metabolism, and if you have too much uric acid in your blood, then you can get these uric acid crystals in your joint. And usually the joint that's affected is the big toe joint. Simply by using warm water soaks and taking 2 medications that can really help the uric acid go away, can alleviate your symptoms quickly and within a day or 2.